Hi everyone, this is Dr. Jeanette DeWitt with DeWitt Physical Therapy and Wellness, and I'm a physical therapist, an athletic trainer, and a fitness coach, and today we're going to talk a little bit about Concussion 101. This class is perfect for coaches, for parents of student athletes, for athletes themselves, as well as avid exercisers. And what we're going to talk today a little bit about is what is a concussion? How do you get a concussion? When can a concussion occur? How can I reduce the likelihood of a concussion? And what do I do when I suspect a concussion? We're going to go through those and answer some questions. So first of all, what exactly is a concussion? Well, a concussion is actually a mild traumatic brain injury. And it really is a mild traumatic brain injury. So when we hear somebody who gets their bell rung, or they get a zinger, or they feel a little off, these are kind of the catch-all phrases for a concussion, but it's truly a mild traumatic brain injury, and the symptoms and the signs associated with a concussion should really be taken seriously. Now, how do you get a concussion? There's a few ways that you can get a concussion. One is a direct bump to the head, a direct blow to the head, a direct jolt to the head. For example, think of a push or a shake to the head. And then you can also get a concussion from an indirect, abrupt movement. So if you think of a car accident where somebody suffers with whiplash and their head kind of goes forward and then bounces back, the brain inside the skull will move, and when the brain hits the hard bone of the skull, that can create a concussion, even though there was not a direct blow to the head. So those are some ways that you can get a concussion. Now, when can a concussion occur? Well, it can occur in a sports practice or a competition. It can occur in games, a motor vehicle accident, like I mentioned with the whiplash. It can also occur, and this is a true story, I actually had a patient get a concussion because they were getting out of the car, they were bending over, they started to stand up, and it was a very windy day, and a door actually hit them in the head as the door was being blown shut. So they were just minding their own business, getting out of the car, and the wind pushed the door into their head, and they received a concussion from that. The other place that is a common area to suffer concussion is the weight room. I've also had a patient who was using the lat pull-down machine, and when her friend got up, the bar was still swinging, and it clocked my patient in the head and put a gash into her forehead, and she suffered a concussion from that. So it doesn't always have to be athletic competition. It doesn't always have to be a practice. It can be normal everyday activities that we do on a regular basis. So be aware of that. And speaking of awareness, when or how can I reduce the likelihood of getting a concussion? Well, what I like to tell my athletes is I want you to think of your head being on a swivel. You need to know where the ball is or where the puck is at all times. So you need to kind of think of your head being on a 360-degree swivel and always knowing where the ball is or the puck, because that's where people are going to be heading. And if the ball is coming towards you, or if the puck is flying towards you in hockey, you need to be aware of those objects, the ball and the puck, but you also need to be aware of other participants on the field or on the ice or on the court, because they're going after the ball. They're defending their position. You're going to collide. And that collision, if you see it coming, or if you see the ball coming at you, you can prevent the ball, the puck, or a person from hitting you and creating a concussion. Whether it's a direct blow or a body check that is going to cause your head to whip back and forth, that those can be prevented is if your eyes and your head are constantly aware of what is around you. So that's what I tell my athletes in competition. But what about a non-athlete? Well, if you're a spectator at a basketball game, at a hockey game, at a lacrosse or a field or a soccer game, never have your back to the field or to the court or to the skating rink. You want to make sure that you, as a spectator, are watching for the ball or the puck as well. You don't really have to worry about somebody body checking you like an athlete or a participant who's playing the sport, but you do need to be aware of where the ball is and the puck is at all times. So you don't want to have your back to the playing field, so to speak. And I've had a patient actually be walking out of an arena from a volleyball game and get hit in the head with the volleyball. They had been cheering, the game wasn't over, they had their back to the ball and to the court, and they got clocked in the head with the ball and suffered a concussion. So you always want to be aware of your surroundings. The same goes for working out or in the weight room. You want to make sure that when you're walking by a machine that could possibly be moving and have moving parts, that you are steering clear of those moving parts. I used the example before about the person in the weight room with the lat pull down. As the person who is exercising, when you pull the lat pull down and that bar down, when you get up, to protect yourself, hold on to the bar and stand up. But to protect other people who might be switching in and taking turns with you, you want to hold the bar for them so it doesn't clock them in the head. The other thing is when you're walking past weight machines, like a chest press machine, these are moving parts. A leg press machine where you're pushing your legs up. These are moving parts. If you don't clear that space, you're going to get hit, and it could likely be in the head or in the body. So when you're walking through the weight room, you want to be aware of your surroundings and give yourself ample space to move around in, so that you're not going to be hit by any moving parts of a machine inadvertently. Now, what are the signs and symptoms of a concussion? First of all, let's talk about what is the difference between a sign versus a symptom. And a sign is something that you are going to witness in another person. These are things that you see happening to the other person, but you are not experiencing them yourself. A symptom is something that you experience yourself. So let's talk about signs first. Signs of concussion are, you notice that whether it's your child who was a student athlete, or whether it's a friend of yours or a teammate, you notice that they're walking around a little bit dazed and confused. Like they're really walking around tentatively and not quite sure of where they are. You may also notice that they don't have trouble, they are having difficulty remembering plays in the game, and they're having difficulty concentrating. Another thing you might notice is that they're moving kind of awkwardly or clumsy-like. Usually an athlete, who has not suffered concussion moves very fluidly, moves, exactly where they need to be. The person who might have had a mild concussion and not realizing it is often in the wrong place on the field or on the court. They're kind of moving around just awkwardly or clumsily. Now, the other thing you may notice is that this person's constantly asking questions. Well, they're asking questions because they don't remember. So they're asking the coach questions during a timeout, during halftime. They're asking you to repeat the answer because they can't remember it. These are things that you might witness in a friend or a teammate. The other thing is if you witness that they lost consciousness. Now, it could be just for a little bit, or it could be for a decent amount of time. If they got the wind knocked out of them and they aren't aware, and you go over, you're the first person, and they've lost consciousness, that's a sign of a person who has suffered a concussion. They also may demonstrate behavior changes or personality changes. So if they're usually very patient, if they're usually very even keel, and then suddenly they're kind of lashing out, they're really quick-tempered, things like that, that's abnormal for them, then you want to make sure that you're asking them questions. Are you okay? Do you know where you are? Do I need to talk to the coach or a parent about what you're witnessing? Now let's talk about symptoms. Symptoms, again, are what you may be experiencing or feeling. If you are feeling like you can't think clearly, like you're foggy or groggy, if you're having trouble concentrating, these are signs, or excuse me, these are symptoms that you may have a concussion. If you feel like a headache is present and it's not going away, if you feel pressure in your head, if you feel nauseous, and this may include vomiting or it may not include vomiting, but if you have nausea, these are also signs, excuse me, I keep saying that, it's symptoms. These are also symptoms that you are experiencing or could be experiencing a concussion. Now, some other symptoms that you may experience could be double vision, blurred vision, numbness, tingling, kind of light and noise sensitive. Like even on a rainy day, you feel like you have to wear sunglasses because you're just very light sensitive. And fluorescent lighting at a school or at an office is just excruciating for you. So light sensitivity and just a hypersensitivity to the light or to noises can be symptoms of a concussion. The other thing that a lot of people don't kind of mention is they feel a little irritable, like little stuff just kind of gets on their nerves or bothers them. They don't feel right, they feel off, or they're sad, and they have these emotional ups and downs, and they're kind of all over the place. These are things that they may or may not recognize in themselves, or they just feel off, but they don't know how to explain it. Another one is nervousness or anxiety. They feel anxious. And the reason they often will feel nervous or anxious is because they don't know why they're so sensitive to the light. They don't know why they're so sensitive to noise. They don't know why these little things keep bothering them and why they're irritable. And they can't seem to figure it out because they're kind of foggy. So these are all symptoms that could be a symptom of a concussion. The last symptom that sometimes can also be a sign is sleep disruption. So a person who just is tired all the time, their parents may notice this, or a teammate may notice this, or coaches may notice this as well, that they're just really tired. Then the opposite of that can be true too, is that they can't sleep. They're just restless. Any changes in sleep behavior can be a sign or a symptom of a concussion. Now, what should you do if you have a student athlete, whether you're a coach or a parent, who does experience a concussion? It is recommended that you seek a healthcare practitioner sooner than later. If your student athlete, or if yourself, if you're feeling any of the signs or symptoms that I mentioned, or if you're witnessing the signs and if you're feeling the symptoms, then you want to report that to a healthcare practitioner. And if you have the following symptoms and signs, then these are red flag observable signs that you want to go to the emergency room immediately. The red flag signs are a decreasing level of consciousness. They're kind of awake and then they're kind of fading out. That would be a red flag. Increasing confusion is another one. They're disoriented. They cannot tell you where they are. They can't count backwards. They can't remember what you said 5 minutes ago. An increase in irritability would be another sign or red flag. The loss or fluctuating level of consciousness, like they're here, then they're not. numbness in the arms and legs. The pupils become unequal in size. Repeated vomiting or seizures. Slurred speech or the inability to speak. Inability to recognize people or places. And then a headache that is just getting worse and worse and worse. These are all red flag signs that you need to go to the emergency room immediately. Now, how long, this is a question people often ask me, how long does it take for someone to recover from a concussion? This is a very loaded question. It's very tough to determine when somebody can come back from a concussion. So I will not give a general blanket statement because everybody who has a concussion is different and their timeline is different. However, I will use the National Athletic Trainers Association position statement on concussion and their return to play progression. I follow that with my patients who have concussions, and the physicians that I've worked with also follow that. Most athletes, if they've suffered a concussion, this is very important that you know this, you can expect them to be out for 1 full week of competition at a minimum. That's 1 full week. So if they get a concussion on Saturday, they're not playing in another competition, another game, for at least 1 more week. No athlete who suffers a concussion should expect to return the same day. And these two things are really important because a lot of times people will minimize, oh, I just got my bell rung. I just got, a little minor headache. No athlete should be expected to return the same day that they experience a concussion. And it should be emphasized that they will probably not be returning to full competition for at least 1 week, unless there's a physician who clears them to play sooner. Athletes should not even begin the return to play progression until all concussion symptoms are absent. The clinical examination is normal, and their performance on objective concussion assessments are normal or at pre-injury level. Those 3 criteria have to be met. I'll repeat those. All concussion-related symptoms have to be absent, completely gone. The clinical exam has to be normal, and all objective concussion assessments have to be normal or at pre-injury levels. Super important that an athlete who still has minor headaches does not return to play. As I mentioned before, the National Athletic Trainers Association has a position statement on concussion and on return to play. And I encourage you to just Google that, National Athletic Trainers Association position statement on concussion. If you Google that, you will get this return to play criteria as well as a host of other information. Most of what I'm sharing with you today is from that position statement as well as the Wisconsin concussion fact sheet for athletes. The return to play progression for an athlete who has suffered a concussion, stage 1 is no activity. One of the best things that you can do for a student athlete or anyone who's suffered a concussion is cognitive rest. What is cognitive rest? It means no technology, no TV, no smartphone, no tablet, nothing that's going to make the eyes have to work very quickly. The eyes tell your brain how to be active. Getting into a dark room with no technology, no sound is one of the best things you can do for an athlete or for someone who has suffered a concussion. The sooner they can get cognitive rest, the sooner their brain can actually heal, because it's not having to be hyperactive, tracking and scrolling down on a computer screen, scrolling down and jumping their eyes to and fro on a smartphone or a tablet. And they can just have cognitive rest with very little noise, very little light, allowing their brain to heal. So stage 1 of return to play is no activity. Stage 2 is light exercise, about 70% age-predicted maximum heart rate. This is when they've completed stage 1, they have no symptoms, they can go on to stage 2. Stage 3 is sport-specific activities without the threat of contact from other people. So this is walking through a practice, keeping it again 70% of their maximum heart rate, sport-specific drills, skills, no contact. Stage 4, again, is non-contact training involving others, such as resistance training. So this is where they can start to do some strengthening. Stage 5 is unrestricted training. So now they can participate in a practice, they can participate in all skills, all strength training, including contact. And then stage 6 is to return to full play and competition. Each stage requires 24 hours in between each stage. This is why you can expect an athlete to be out of competition for at least a full week, because it's going to take 6 days, 6 stages with 24 hours of in between that particular stage of activity to meet the requirement to get back to full play within 7 days. Now, all stages, like I said, should be separated by 24 hours. So if the person participates at a 9 a.m. practice, say at stage 3 level where they're sport-specific skills, then 24 hours, if they have no symptoms, they can go on to stage 4. Let's say they have a mild headache after they did the stage 3. They do not go on to stage 4. They would stay at stage 3. Depending on the severity of the symptoms, they may actually regress and go back down to stage 2 and stay there until they have no symptoms. So you can see that these stages are very much modeled to an individual and progressed based on the individual. Every athlete will progress through this timeline at their own rate, and that is intentional, but this guideline helps to identify what the key parameters are to advancing. So they can't advance to the next stage if they have a return of concussion-like symptoms. They need to regress backwards or stay on that stage, depending on what the physical therapist, the certified athletic trainer, or the physician determines with that athlete or with that individual at that time. I thank you very much for joining in today. This was Concussion 101. This is very important because concussion is considered a mild traumatic brain injury. You've learned today the signs and symptoms of a concussion. You've learned when a concussion can occur, and you've learned what to do when a concussion does occur and how to return an athlete or an individual back to play based on the National Athletic Trainers Association position statement on concussion. And again, if you Google that and if you look up the Wisconsin concussion fact sheet for athletes, you'll get a lot of this information. If you have questions about concussions, or if you've suffered concussion and are still experiencing symptoms but haven't sought out a healthcare practitioner, I would encourage you to do so. If you'd like to contact me, that's fine. You can reach me at 262-842-2220, or you can visit my website at www.dewittptwellness.com. And you can also email me directly at Jeanette@dewittptwellness.com. Thank you so much for joining in. I see Joelle is here. I see Ruth is here. I don't see any questions in the chat. I welcome your questions. You can always put those into the chat at a later time, especially if you watch this on a replay. Thank you very much for joining me today, and I hope that helps give you lots of information about Concussion 101. Have a great day.